Hi, epileptic seizures can happen at any time and to anyone, even when the camera is rolling. Let's have a look at the most dangerous epileptic seizures caught on camera. Looks like mom is someone having a seizure in the swimming pool. Oh my god, this is a dangerous situation. Can drown easily. Oh my god, this kid came to help. Oh, look at that kid. He's 11. He's doing a good job. Still having the seizure. The dogs called for help, so her dad lives next door, so he came to help her. So if you have somebody like this in a seizure, the way to help them during the seizure is to make sure they're safe, not hitting their head on anything hard. The environment is safe around them. Then for her, make sure that her head is above the water so that she can breathe, and then turn them on the side, put a pillow under their head, stay calm, and time the event because it's very, very important. Time the event, how long it lasts. You loosen any clothes around them so that they don't choke, and most important, do not put anything in their mouth or their teeth because this can break their teeth, and there is nothing called tongue swallow. It's a myth. It does not happen at all. So make sure that when you turn them to the side, if there's any vomiting or anything, it will come out of their mouth. Because she's like literally fighting for her life. So confused and scared. So this happens a lot in seizures. When the seizure ends, there is a state of the brain confusion as just recovered from the seizure, and the patient will be confused, disoriented, can be aggressive, can be like not recognizing their surrounding. Imagine like somebody wakes you up from sleep and somebody is like in the middle of the night and you're scared and frightened. That's what happened to her, and she's like fighting and she cannot control herself very well. So this is post-ictal state, and it's a dangerous state sometimes. And I see like police having people crash into an accident and then they cannot respond because they're in a seizure, and they start talking to them and they don't listen to the police and they assume there is something dangerous, hands off the wheel and all of that. So it can be a dangerous situation. So the car is crossing the intersection. Oh my god. And her friend is running around to help her. She's calling seizure, seizure, she's having a seizure. Oh my god, it's so dangerous to have. Call for help. The car is not stopping. I'm surprised lots of good people are coming to help. Wow, they're able to stop the car, but she's locked inside the car. Ooh, trying to break the windows. This is very dangerous when somebody loses consciousness during driving. If somebody has seizures, they should not be driving for at least 6 months from the last event, and sometimes the time varies from one patient to another, and there are local laws that you should follow, and the laws usually vary between 3 months to 6 months to 9 months or even 1 year. Some lady found the dumbbells. She gave it to the guy who is more beefy than her. Finally, they broke the window, opened the door, tried to help her. Even though they thought that it was a seizure, this patient did not have a seizure and ended up having syncope, what we call. She was preparing for colonoscopy and lost lots of fluid in that preparation. She took the blood pressure medications that dropped her blood pressure a lot, ended up having passing out event. So seizures or passing out events, all of them are dangerous if they happen behind the wheel. Lots of patients have disastrous car accidents, and it's kind of, if you drive with a seizure, like you're driving with a car that has a red engine alert, and I'm sure that you won't drive your car if you had the red engine alert, and you should not drive if you have seizures. Oh my god, not in the airplane. Very high, 12,000 feet. Oh, that's a big jump. now I lost him. Oh my goodness, he's having a seizure. Oh, please catch him. Please catch him. The worst place and time to have a seizure is 12,000 feet above the ground. Definitely a scary experience. And the reason why he had seizures is probably because of the provoking factors or triggers for seizures, which can be extreme emotional excitement, maybe lack of oxygen or like high altitude have also played a role. Other major triggers for seizures is missing medications, which is the most common, sleep deprivation or staying up late, or erratic sleep schedule. Drinking alcohol is a major trigger for seizure. Also, any physical or psychological trauma like extreme stress or infections and fever can trigger seizure. Became conscious safely 3,000 feet and managed to land parachute. So that's a major issue because after the seizures, as we explained, that the patient will be confused, not able to control themselves. So even though his parachute was up, he was not able to control it at the beginning because he was just having a seizure. And then after the seizure has ended, luckily, like there was 2-3 minutes until somebody will have some control. And imagine like waking up from a seizure, finding yourself like dropping in the parachute. He was able to control it. And you know what? Like lots of times when you have a seizure, you lose memory around the seizure event. So he might not have remembered all of this experience or all of this jump that maybe he paid a lot of money to have. And thank him. And you know, we all thank him for uploading this video online. Unfortunately, about 10% of people having epilepsy, they have major accidents and incidents like this, and they even can die because of these complications. This all might have been preventable if he used the new anti-seizure medications and the new treatments available for epilepsy that I explain in details in this video for all the new treatments and the excitement advancement in the epilepsy treatment for the best results. And stay healthy and see you in the next one. Salam.